Good morning to all present here. Today we'll be seeing about record bases and occlusion rims or the occlusal rims. Uh, these are the contents that we'll be seeing today. We'll go straight to the record bases. Now, the record base or a base plate is a temporary form of denture base, which is representing the base of a denture. That is mainly it is used in recording maxillomandibular relations and in the arrangement of teeth. It is also called as a trial denture base or a denture base plate, or it is also called as a trial denture base or a denture base plate or a record base. Now coming on to the requirements, it should have an accurate fit and it should look almost similar to the completed denture. That is a finished final denture. It should look similar, and main requirement of this denture base is to resist the fracture or flexure or your deformation due to the biting force. And how you will achieve this is with the help of having a thickness of around 2 mm at least, that is 1.5 to 2 mm of thickness should be present for your denture base. So this will help the denture base in being dimensionally stable, and it will resist fracture or flexure. Now coming on to the timing, it should be easily and quickly um, fabricatable. That is, it should be easily fabricated, and also you should make sure that the wax occlusal rim is actually sticking to the denture base that you have fabricated. So this is much more important, because without the wax occlusion rim sticking to the denture base, you cannot carry on with your maxillomandibular jaw relation and having a record and transferring it to the articulator. Now coming on to objectives, the main objective of a denture base is to make sure that the occlusion rim stays in the denture base. That is, the occlusion rim should stick with the denture base. That is a wax rim. Generally, it's a wax rim. There are many ways of making your occlusion rims, but primarily the most versatile method to make an occlusal rim is by using a wax to form an occlusal rim. This is the basic this thing. And next is to aid in transfer of your accurate jaw relation. That is, once the denture base and the occlusal rim form a occlusion block, this block is used in um, taking the maxillomandibular relation of a patient. That is the jaw relation of a patient. Mainly, you will be doing a vertical jaw relation rather than a horizontal jaw relation. Also, this occlusion block will enable in the setting of artificial teeth in the trial denture. That is, the record base with your occlusion rim with your teeth arranged will actually be called as your trial denture. Once you um, flask it, dewax it, and pack it and cure it, you will get the final denture. So until then, it is called as a trial denture. Now coming on to the treatment of the casts. So treatment of the cast, why does your cast require a treatment, is because there should the main aim is there should be no irregularities in the cost. Irregularities can be anything like a small nodule or a void or anything. So if there is a nodule, what you can do is you can scrape the nodules with any sharp instrument to make it even, or if there is any void, you can try to fill the void using a suitable gypsum material. This is your minor correction of your model, that is your patient model or patient cast, but you should make sure that these kinds of errors do not pop up in your model, right? Okay. Now coming on to your major correction. Major correction is mainly trimming the cast or your model, trimming the model. Mainly the reason of trimming the model is to make sure that the a record base and the occlusion rim block, that is the record block, is easily retrievable from the cast and it is placed in the patient's mouth, and it can also be removed from the patient's mouth and easily placed in the cast. So you should make sure that you're trimming in such a way that this is possible. That is the thing which shows that cast must be trimmed to provide adequate access to the border reflections. Now, also, your record base should be accurate enough such that it will adapt properly to the tissue surface in the patient. Now, coming on to relieving the undercuts. Undercuts are those areas where there is caving in of your anatomical landmark. Caving in the sense there is some kind of void or anything in the patient's mouth itself. That is how the shape is. So, what happens is if any denture based material goes inside, it will get with the um, interlocked with the tissue. So you should make sure that those kinds of caving in are actually filled up and made straight. That is, it should be perpendicular to the floor. That is, it should be perpendicular to the floor of the mouth, meaning it should be straight, so that you don't have any problem in pl- taking it out of the patient and also placing it inside the patient. It is called as angle of insertion. So your angle of insertion should not have any kind of um, hindrances to place it and remove it. The reason we are actually relieving the undercuts is because if you engage the undercut, there are two different types of undercuts. One is your favorable and another is your unfavorable undercut. Your favorable undercut, you can you can engage your favorable undercut, meaning you don't have to block it out. You can engage it with your denture base. Your unfavorable undercuts are those which have to be blocked, meaning those should not be replicated in the tissue surface of your denture. So these will be relieving the undercuts. So where all will you be relieving the undercut is bony alveolar process, any soft tissue undercut, or any bony tori. Bony alveolar process is your alveolar crest. Mainly, the way it is relieved is with a suitable plastic material. The plastic material can be wax or a plaster pumice mix. 1:1 ratio of plaster pumice mix can also be used. Now, as I told you earlier, here you can see that this is mainly used to permit easy removal and replacement of the denture base, and also it will help in prevention of abrading or breaking of the cast surface. That is, your impression surface is actually protected by this. If you fail to block out the undercuts or relieve the undercuts, what happens is there can be flexure of the record base. That is, when you are placing it in the patient's mouth or when you're placing it in the cast, the denture base will have a separate um, shape, will have a different shape than one which you will see after you remove it from the cast. So that is called flexure of your record base. Now coming on to distortion is, for example, because of this flexure, if it is within the elastic limit of your material, then the material will rebound to its original shape. If the flexure of the record base is beyond uh, um, is the flexure of the record base is uh, beyond the elastic limit of the material, then it will lead to distortion of the denser base material. So these two should not happen because this will hamper the proper fit of your denser base. Now, if the flexure of the record base surpasses your elastic limit and it goes beyond the elastic limit to a very high extent, then it will result in breakage. That is called your plastic deformation. Now coming on to materials which are used for fabricating record bases. You have two types of record bases. One is your temporary record base and other is your permanent record base. In your temporary record base, it will help till the fabrication of a trial denture. So once after the trial denture is done, before you're going to process it, what you're supposed to do is, that is, after the um, so after your wax boil out process, that is dewaxing process, what you will do is you will have to discard your trial denture base, that is the temporary record base, and then you will have to pack it with your permanent denture base material, that is your heat cured acrylic resin. Now coming on to permanent record bases, these permanent record bases will not be discarded even after dewaxing, but what happens here is you will have to use that as a permanent denser base for your packing and curing process, right? So that will be your permanent record base. Coming on to temporary record base materials, we have shellac base plate, reinforced shellac base plate, autopolymerizing resin, or and light cured acrylic resin. We have vacuum form sheet, or which is made of vinyl or polystyrene. And lastly, we have the base plate wax as your temporary denture base or your record base. Coming on to permanent record base, we have two types. One is metallic and non-metallic. Non-metallic, as you know, it is your heat cured acrylic resin, and metallic will be, that is, it will be a cast metal. That is your, it is similar to your metal coping which is being cast for your crown. Okay. The same way, what happens is here the denture base, mainly the palatal portion of your permanent denture base, contains either gold alloy, cobalt chromium alloy, or nickel chromium alloy. Now coming on to your shellac base plate, the way to fabricate is, first you need to soak the cast in a slurry water for 5 minutes. Slurry water is made by mixing either stone or plaster in a water full, a rubber bowl full of water. Okay, so what happens is, once you add this stone or plaster, depending upon what cast you are going to, what type of cast, that is either stone cast or your uh, plaster cast, you are going to soak it, you will have to add the gypsum material accordingly. And then once the cast is soaked for around 5 to 10 minutes, what you do is you will remove any undercuts, that is blocking out all the undercuts, after which you apply the separating medium, and you take a shellac base plate which is softened with a flame. You will soften the shellac base plate with a flame, and once it is softened, it will be like normal wax only. It will not stick to your, but it will be very soft and pliable. So what you do is, once it is softened, you place it on the mandible or the maxilla, and you will adapt accordingly with your fingers. You should make sure when you are adapting it, you should make sure that there are no air bubbles or voids which are present inside. It should, you should be able to see the tissue surface of your model completely in the denture base. So that means, that shows that your denture base is accordingly uh, adapted properly. That is, this shellac base plate has a very intimate adaptation, so that there'll be no gap between your denture base and your tissue surface. Now, after you adapt it properly, this, all this excess is removed using a scissor, or curved scissor, especially a curved scissor, or you can use a BP blade to cut it out. You will have to soften the excess portion, then cut it out with your BP blade. Now, what happens is, if you have any glossy areas without adaptation, you should make sure that you adapt them properly. One idea is that what you can use is, you can use a ear cleaning bud to adapt in the sulcus region. Now after this, after you soften it and it is adapted, it will get hardened again, and after it gets hardened, you can remove it and then trim the excess, and also give relief in the frenum and other areas wherever it is required. Now we'll see about certain modifications in the shellac base plate. One is with a one is a reinforced shellac base plate, where it is reinforced with a stainless steel wire, that is your ortho wire, which will be used for wire bending, which will you will read about it in third year. So that stainless steel wire is used to reinforce the shellac base plate, that is it makes it stronger. Okay, shellac base plate as such it is weaker. So what you do is you will add this stainless steel wire to make it stronger. So what you do is, first, similar to what I told you before, you will relieve any undercuts. You will apply a separating medium if required. Generally, we don't apply separating medium for a shellac base plate because since it is wet, since the model is wet, you don't have to apply a separating medium mainly. So after this, what happens is your shellac base plate is softened and is adapted, and also a flattened wire or any wire which is adapted to the shape of your um, ridge contour is actually adapted over the shellac base plate, and you can either use another layer of shellac base plate or you can cut thin strips of shellac base plate and soften it and place it over the stainless steel wire and just fuse it along with your shellac base plate. It will get fused completely. Okay. So this is one way of doing this reinforced shellac base plate. Now coming on to stabilized shellac base plate. Here what happens is you will not use any reinforcing stainless steel wire, but what you will do is you either use a impression material or an autopolymerizing resin, that is your self-cure resin, to reinforce the strength of the shellac base plate. Here mainly you will use shellac base plate for the uniform thickness of the material. It will be around 1 to 1.5 mm of thickness will be there. So generally for a stronger base plate you will need what around 1.5 to 2 mm of thickness. So this extra 1 mm of thickness can be added. So this extra 1 mm of thickness can be added to reinforce the shellac base plate. So this will be a stabilized shellac base plate. Now coming on to advantages, the main advantage is that, as I told you, it has a intimate contact with the master cast, and it to fabricate it you require only a shorter period of time. It is inexpensive, and also it can be uh, refabricated easily, and also it can also you can also do certain corrections if required. The main advantage is its uniform thickness, so that you don't have to trim the palate region. Okay, so that is the main advantage. And after this, if you want to reinforce the shellac base plate, then it will stay much stronger. So that is the main advantage. Now coming on to the disadvantage, mainly they are not satisfactory because they can easily warp, they can flex very easily, they can distort, which and also since they are brittle, it is easy to break. Even if the patient gives a little amount of bite force or anything, it is going to get warped or it is going to get broken. Now, for example, if you are going to reinforce the shellac base plate, is going to be bulky. Mainly you will the bulkiness is seen when you will be using a reinforced, that is the stabilized shellac base plate by using any elastomeric impression material or autopolymerizing resin. Otherwise, if you are going to use a reinforcing method by using a stainless steel wire, it will not be very bulky. Now, another disadvantage is the taste and odor of the shellac base plate. It'll have some kind of what to say an avoidable smell only. It will not be so. I mean, it's not even acceptable actually. It will be that smelly. So you don't generally use this shellac base plate. Now coming on to your self-cure acrylic resin or cold cure acrylic resin. This is the polymethyl methacrylate resin that you use for your sprinkle-on method, which you do. So, uh, what are the methods that we have? We have sprinkle-on method, finger adapted bow method, flasking method, stone cold method, and wax confined method or swaged method. Mainly now I require you to listen to this carefully, so that we'll be repeating some methods in the other variants of your denser base. So make sure that you listen to this carefully, right? Now coming on to sprinkler method that you do every day for your record basis and your special tray. What you do, you first relieve the undercut. After that, what you do, you apply separating medium to the cast. Then you apply monomer and polymer in layers until you gain a thickness of around 2 mm. Right? That will be the basic thickness of your denture base. Now, now what you can do is you can either leave it as it is so that it will get set and it will get cured, or you what you can do is you can place it in a pressure pot for 20 minutes at a pressure of 20 psi. Okay. Now coming on to finger adapted dough method. Here what you do is you will mix powder and liquid of your self cure acrylic resin, and once it reaches the dough stage, what you do is you will place it in between two glass slabs separated by a coin. uh, Mainly the thickness of the coin is around 1 mm or 1.5 mm, so that much of thickness is actually sufficient. So what you do is you place the coin between two glass slabs and you press the uh, dough to make it flat. Now what happens is this flattened dough will behave like a sheet. So what you do is you place it on the uh, edentulous model and you adapt it using your fingers, similar to the way that you adapt your shellac base plate. But only drawback here is that you should do this before the material sets. So until the material sets, you will have to adapt it with your fingers properly, so that as it is setting, you should make sure that there is no warpage, or there is no um, there should not be any it should be properly adapted to your model mainly. Sometimes what happens is if you don't adapt it properly, there is going to be a void in between the tissue surface and your denture base. So once this sets, what you can do is you can remove it and trim it normally with your lathe machine. Okay. Now coming on to the confined dough methods. Confined dough method means it is similar to your finger adapted dough method, but what you do here is you will already create a mold to adapt the denser base resin in the dough stage, and it is adapted in the dough stage, and once it sets, it will form the record base. So what do we do here? One is stone mold method. What you do here is you will adapt your um, modeling wax or your base plate wax, and you will give indentations in the land area of the cast. And now what you do, you box the model master cast and you pour either plaster or stone to form a mold. As you can see in the third picture, it is clear. Okay. Now, once this mold is formed, what you do is you separate the two molds. That is one mold, and the master cast is separated, and the wax is discarded. Once the wax is discarded, you will have you will have the space between the one half and the second half, so that in that space you will have to adapt your self cure acrylic resin. Okay, this is the way you do it. Another method is you can use a dental flask to do the same thing. That will be your flasking method, right? Okay. Now coming on to your wax confined method. It is similar to your stone mold method, but what you do here is you will adapt wax spacer, or you will adapt your uh, base plate wax to the contours. You will adapt it to the contours of your master cast, and once the adaptation is done, you will remove the excess around 2 mm away from your sulcus depth, as you will cut it for your special tray. As you will do it for your special tray, you will cut it like that. That is, you will do similar to your spacer adaptation technique. Cut 2 mm away from your sulcus depth, and what you do is you will remove the adapted wax and fill it up with your self cure acrylic resin, and again place it on the model. Okay, so what you do is, after you place it on the model, if at all the self cure acrylic resin does not flow into the sulcus, you can use your sprinkle on method to fill those regions up, and once it is set, you can remove it and then trim it and use it as a then record base, right? Okay, this will be your wax confined method. This also, you can also cure it in a pressure pot. Okay, this also can be done. Now coming on to flasking method. This is similar to your uh, mold method, that is your stone mold method. It is similar to this, but only thing what you do is, in that stone mold method, your molds are open, that is your molds are bare, but what you do here is you will use a flask to make a mold, and then you will place self cure acrylic resin in a dough stage, and you will press it completely so that you will get a denture base. In all these methods, what you're supposed to primarily do is, first you will have to block out all the undercuts with either wax or a 1:1 ratio of plaster pumice mix can be used to first block out all the undercuts, and then only you will do all this. That is, after applying separating medium and everything, then only you will do all this. Okay. Now coming on to light cured acrylic resin, it is similar to your finger adapted dough method, but here the only difference is that your um, denser based resin will be in the form of a sheet which is cured using a light, either it's a UV light or any other blue light or anything, which will which has a specialized curing unit to cure it. It'll look something like an oven, so it'll cure the acrylic resin sheet. Okay, so is called as your light cured acrylic resin. Here you do the same thing. You relieve all the undercuts with either wax or plaster pumice mix, and you apply separating medium, and the sheet material is adapted all over the model, and you place it in the curing unit for 4 minutes. So what happens when you place it in the curing unit for 4 minutes? It will cure the outer surface of your denture base. Now after curing the outer surface, you will have to cure the inner surface. So what you're supposed to do is, you're supposed to remove it from the cast, place it upside down again in the denser again in the curing unit. One advantage is that there will not be any distortion of the denture base, even though we are removing it and placing it in the curing unit. There will not be any um, distortion, because the outer surface is cured, that will be rigid, so the inner surface will also get cured without any um, distortions. Okay. Now, after this curing is done, you can smoothen it and polish it also. If you want, you can polish it. Generally, you smoothen it. Now, coming on to vacuum form vinyl sheet and polystyrene sheet. Here, the vacuum form meaning vacuum form word suggests that the polystyrene sheet or the vinyl sheet are adapted to the model with the help of a vacuum. So what you actually do is, you will do the same thing. You will first relieve the undercuts. You will relieve the undercuts using wax or um, plaster pumice mix, and then you will apply the separating medium. And once it's dry, what you will do is, you will place the vacuum form sheet in the heater, which is shown here. On this region you will place the vacuum form sheet, this region you will place your model. So after placing these two properly, your machine is switched on, and this portion will create some heat on this polystyrene sheet, and once it starts to sag down, this portion this portion is abruptly pushed down here, and a vacuum is started. Okay, vacuum machine is started. It will pull all the air out. So with that vacuum, your polystyrene sheet will get adapted to your um, s- stone cast. That is your patient's master cast. Okay, after this adaptation is done, you will run the vacuum for 30 seconds more. After this 30 seconds, once it's cooled down, you will remove it from the machine, and you will cut it out accordingly, and trim all the unwanted regions and the flash. Okay. And one more thing here is, if you're using this vacuum form polystyrene sheet, what you're supposed to do is to smoothen the edges of your this thing. You should use something called as some kind of rubber trimmer. That will be different. It's not your vulcanite trimmer, but it will be a rubber trimmer, which will be different completely. I'll show this model in your lab classes. Okay, so this will be your vacuum form sheet adaptation. See, this is how it look after you make the adaptation. That is, here your dentulous model is shown. Just imagine doing this in an edentulous model. It will look similar to adapting your wax sheet. Okay. Now coming on to advantages, the biggest advantage is that it is easy to fabricate. It has uniform all over thickness, and you don't have to do so much as to adapt the this thing with your hands, and it has a good rigidity. But the only disadvantage is that you should use a specialized equipment for this. Okay, and also to form a smooth rounded borders. But if you will use the proper burrs and everything, you can also achieve a smooth rounded borders. Okay. Now coming on to wax base plates. This is the most easiest method and is commonly used in foreign countries. We in our country we don't use it because ours is a tropical country, so wax doesn't stand a chance. It doesn't have a good rigidity in this sultry climate. So this is not generally used in India, but but in foreign countries you can easily use this because of the chillness and everything. You can easily use it. There is not going to be a big problem with doing this. So what you do here is, you will not actually block out the undercuts in this model. This is only this is the only procedure where you will not block out the undercuts. So what you do is, you will make sure you will not adapt the wax into the undercut, because if you adapt the wax into the undercut, it is going to get distorted once you're going to remove the adapted base plate wax from your model. Okay, so what you do here is, you will first take a stainless steel wire, and you will adapt it according to the tissue surface of your master cast. After this, what you do, you will adapt the wax sheet, and you will place the reinforcing wire. For maxilla, it is 2 mm anterior to the posterior vibrating line, that is the distal edge of your denture. And for mandible, you will have to place the stainless steel wire from the 3-5 to 4-5 tooth region. Okay, so from premolar to premolar, you will be placing it on the lingual side. Then after that, what you do is, here this is your procedure is slightly changed here, because the third point should come in the second, and the second point should come to the third. And after that, what you do is, once this is done, you will simply take it out of the model, and you will place it, either it's better to place it in a uh, chilled environment like refrigerator or anything. But normally, if you have a good temperature control, you can place it anywhere, whatever, wherever is required. So just store it on the sink. The main advantage is that it is very easy to make, and it'll It will not cause any, you don't need any specialized equipment or anything, and it is easily available. It is easily doable also. Now, the only disadvantage is that there is lack of rigidity. That is, it will not be very rigid, or it will not be dimensionally stable. That is the main this thing. Since it doesn't have rigidity, it will not be dimensionally stable, and it is the most prone to um, warping or breakage. You cannot call it a breakage. It is mainly warping. It is the shape of your the denture base will actually change. Okay. So this will lead to improper seating of your denture base in the patient's mouth. Okay. Now coming on to permanent denture bases. One is your heat processed acrylic resin. You will do as if you are doing it for processing a complete denture. What you do is you will adapt the wax. You will do flasking. After flasking, you dewax it and you place a heat cured acrylic resin, mold it and place it for curing. Okay. After curing, you remove the denture base and trim it and polish it. This is how you will do. You would have seen this in temporary record basis also. For permanent record basis also, you can do the same thing. Okay. Main advantage is that it is rigid, accurate, and stable, and it is also suitable for so it has the most advantage. Disadvantage is that it is time consuming. It is not even expensive, but it is time consuming. Yeah. Now coming on to cast alloys. Here your denture base covers your permanent denture base covers the palate region generally for the upper, and your lingual surface in the lower. Mainly, it is made out of cobalt chromium or nickel chromium alloy, or to a certain extent even gold can be used. But generally, we don't use gold nowadays because it is weaker. You have cobalt chromium and nickel chromium, which is strong. Generally, we use cobalt chromium only, which is very very strong. Okay. Now, what you do here is you will duplicate your um, master cast into a refractory cast. That is, you have a refractory material. You will duplicate the master cast and you will pour another cast using this refractory material. So this duplicated cast becomes your refractory model. So what after this, what you do is you will create a wax pattern of this denture base that is only on the the only on the palate surface, and you will attach sprue to it, and you will invest it and do a wax burnout similar to how you um, fabricate a crown. The same way you will do it here. You will do wax burnout, and after wax burnout you will melt the alloy and do the casting. And once casting is done, you remove it, trim it and polish it, and use it as a permanent denture base. So the main advantage is that it is rigid, accurate, dimensionally stable, and it can also be used many number of times, um, provided the denture base is actually rigid and good, and it is not warped or it is not broken. Until it's broken, you can surely use it, and considerably it has some weight. But the only thing is, the patient is more comfortable with this kind of metal denture bases. So generally, this is popular due to the patient acceptance. Okay. Now coming on to faults in the record basis. What are the faults that you can see in record basis is that if you have any fault in a record base, mainly what the faults that you will see in a record base is improper adaptation, porosities, and mainly improper adaptation. Okay, if you have improper adaptation, what happens is you will not get your vertical dimensions properly. There will be inaccurate face bow record, and since you have improper vertical dimension and inaccurate face bow record, when you are mounting it on the articulator, it will also be improper. Okay, so if these three happen, what happens is there is reduced accuracy of jaw relation, which you do not want in your denture. Okay, so make sure that you don't have any faults in the record basis. Now, coming on to your occlusion rims. Occlusion rim. rims are occluding surfaces fabricated on the record basis for the purpose of making maxillomandibular relationship records and arranging the teeth. Another definition is that it is the combination of a base material, that is your denture base, which accurately fits the cast, and an arch shaped material occupying the space of the previous dentition. That arch shaped material is made out of your modeling wax. Okay, this will be your occlusion rim. Now coming on to uh, uses of your occlusion rims, mainly it is used to establish the level of the occlusal plane, the arch form related to the activity of lips, cheeks, and tongue. Meaning, you should make sure that the arch form of your occlusal rim is properly adapted to the arch form of your master cast. So you should always make sure whatever the arch form of your master cast is, the same way your occlusal rim also should be present. Okay. Okay. So this is the thing. Now after that, what you're supposed to do, what you will get is mainly your vertical and horizontal jaw relations. This occlusion rim is used to maintain your or record your vertical and horizontal jaw relation. Also, it can also be used to estimate your interocclusal distance. That is how much ever the patient is able to bite, is what is the interocclusal distance, and the most um, comfortable interocclusal distance is how much ever the patient is able to when after you place the uh, occlusion block in the patient's mouth, the patient should be able to swallow without any hindrance. You should be comfortable in swallowing the denture, swallowing the no, not the denture, sorry, swallowing. He has to be able to swallow anything and everything, even after wearing the denture. Okay, so that is how your jaw relation should be, and it is also used in estimating interocclusal distance, and also this occlusion rim also helps in establishing the position of the artificial teeth, and also it will help in uh, marking the midline, lip line, and also the canine line. And these three lines will help you in selecting the type of teeth and the shape of the teeth that you require for the teeth arrangement. Either you need a small one, or you need a medium one, or you need a large one. You will decide based on these three lines. Okay, your midline, your canine line, and your lip line. Now, fabricating the occlusal rims, we have two methods. One is your roll-on method, and the other one is your ready-made rim method. Ready-made rim method is where you have the occlusal rims which are ready-madely available. Okay, they are available easily, and what you will do is you will soften it in the flame, and you will adapt it according to the arch form of the denser base. And in the roll-on method, what you do generally in your preclinical prosthodontics lab is what you do. You will soften the Hindustan wax or that base plate wax on the flame, and once it is softened, you will roll it without incorporating any air bubbles, and that rolled wax sheet is actually placed on the denture base according to the arch form of the master cast, and you will and what you will do is you will um, okay, so you'll fuse it completely with the denture base. So that is what you will be doing here. Coming on to rolling on method, first what you do is you will soften the modeling wax sheet, the same thing which I explained now, and roll it in a cylindrical shape and adapt it and seal it using a spatula, that is number 7 spatula, or you can use your wax knife. The blunt end of your wax knife can also be used. Okay. So this way. So after you finish with fusing the occlusal rim to the denture base, it should look as if it is you're able to see in this H diagram. Okay. So now coming on to the dimensions of your occlusion rims. Anteriorly, your occlusal rim should be 5 mm thick, and posteriorly it should be 8 to 10 mm thick. Okay. Always remember this. The reason you're doing this is because you should be able to make space for the tongue so that the patient is able to speak properly. Okay. This ready-made occlusal rims, what happens is you will have ready-made rims like this. You will have to just simply soften it over the wax, and you will have to uh, use extra wax to just smoothen it and adapt it to your this thing. Okay. Now coming on to shape of the occlusal rims, as I told you earlier, you should always make sure that the occlusal rim forms conforms to the shape of the arch. You have three types of shapes. One is square or U shaped, tapering or V shaped, or third one is the ovoid shape. You can see it here. Generally, the preclinical model that you have will have a square or U shaped. So, in a square or U shaped, your anterior region will be slightly flat compared to your posterior region. In your tapering V shaped, you will have a complete taper. It will look almost like a V. It is not actually a V, but it will look almost like a V. Okay. And in a ovoid shape, it will look almost like a circle. Almost like a circle. Okay. So that is your ovoid. And also always remember that after you make the occlusal rim, once you place it in the patient's mouth, your patient's mouth should look like this. Generally, before placing the denture base and occlusal rim, it will look like this. So this sagging in of your lips will be supported by your denture base. So that is how you should fabricate the occlusal rim. Okay, so it should be you should have adequate lip support mainly. The main thing is your lip support, and the next thing is your vertical dimension. That is the maxillomandibular jaw relation. Okay. So coming on to dimensions of your occlusal rim, anterior height of your upper rim should be 22 mm, posterior height should be 18 mm. Um, for mandible, it should be anterior height should be 18 mm, and posterior height should be two-third of your retromolar pad. Anterior width will be 5 mm for both maxilla and mandible, and posterior will be 8 to 10 mm for both maxilla and mandible. And posteriorly, what you can do is you can cut at 30-degree angle to the occlusal plane only in maxilla, but not in mandible. Okay. Now coming on to position of the occlusal rims. Now anteriorly in maxilla, it has to be slightly inclined forward. That is, it should be around 8 to 10 mm anterior to your incisive papilla. Okay. This is how you're supposed to place it, but don't try to measure it and place it. It will surely go wrong. Okay. Now, in mandible, your anterior region should be slightly inclined forward so as to give a lip support to this lower lip. Okay. Now, coming on to your incisor ledge, your maxillary occlusal rim should slightly approximate with the vermilion border of your lower lip. Am I clear? Vermilion border of your lower lip should actually approximate with your upper incisor ledge. In the mandible, it should be slightly 1 mm, 1 to 2 mm behind the lingual surface of the maxillary rim. That means your upper rim should be slightly forward and your lower rim should be slightly backward. So this is how it is given so that you can achieve class 1 occlusal relationship. Okay. Posteriorly, if you see maxilla, it should be slightly buccal to your alveolar ridge. and in the mandible it should be slightly placed inwards to your maxillary rim, because here the reason is that your maxilla has a resorption pattern of going inward and upward. Once it is resorbed, it will go inward and upward. Okay, from outside to inside it will resorb, it will not resorb from inside to outside. So what you do is to compensate for this bone loss, or your to compensate for this uh, resorption pattern, what you do is you slightly place the occlusal rim buccal to the alveolar ridge in the upper jaw, that is in maxilla. In mandible, your resorption pattern is from inside to outside. Okay, so what you're supposed to do here, you will have to place the maxillary occlusal rim slightly inward to compensate for the bone loss. Okay, this is the idea of fabricating your occlusal rims. What you'll see is the midline. The first thing is the midline. Here, what you will do is you will bisect the philtrum of the lip and record that on the labial surface of the rim, which is marking the midline. You can see it from the picture here. You will bisect the philtrum of the lip and you will mark the midline. So that midline should be extended from the frenum area to the tip of your maxillary occlusal rim. Okay, so this is how you will mark the midline. Next line is your cuspid line, that is your canine line. So what it will help in is, it will help in arrangement of the anterior teeth. That is, it will give you the extent of your upper anterior teeth. Okay, so this is the main line for selecting your upper anterior teeth, and all the other teeth in your teeth arrangement will depend based on the extent of your upper anterior teeth. Always remember this. Okay. And how you will mark the cuspid line? A line which passes medially on the line parallel to the pupil of the eyes to the corner of the mouth. Okay, so you will have to take the corner of the mouth and also the uh, line parallel to the pupil of the eyes and the corner of the mouth mainly. Here, what we generally do is we will take the outer border of the ala of the nose to be the point of your canine. You can see it here and see this line. It is slightly at the border of the ala of your nose. This portion is your ala, and this will mark the distal edge of the canine. That means the distal edge of your canine should not go beyond this line. So you will check the teeth accordingly and by it. Okay, this will be your canine line or the cuspid line. Your canine is called a cuspid and your premolar is called as a bicuspid. So always cuspid means it's a canine. Okay, always remember this. Now coming on to your smile line. Here, the patient is asked to smile wide, meaning that the patient is asked to smile as if he is laughing or smiling wide, so that the occlusal rim is visible. Wherever he is able to smile the greatest, that line, the region where his lip stops exposing the occlusal rim, will mark the smile line. Okay, you will have to mark the smile line horizontally from one end of the mouth to the other end. Okay, so what the main aim of this line is that it will mark the gingival zenith of your teeth arrangement. Gingival zenith is the highest point or the deepest point of your, what is that, gingival carving. That will be your zenith. Okay, so this is the main use of your smile line. So for your preclinical work, these three lines are more than enough for marking your this thing. Okay, thank you. If you have any doubts, you can please ask me. Feel free to ask me.